Good morning, all.
Good morning, ma'am.
Okay, today we are going to study about the thoracic cavity. Okay, so this is called as thoracic cage. So what do you know about thoracic cage?
It has 12 pairs of ribs.
Very good. It has 12 pairs of ribs. Okay, what are the types?
3 ribs.
Okay, what are they?
True ribs, false ribs, and floating ribs.
Okay, how will you count the two ribs here?
True ribs is 7.
7 ribs. So first to 7 rib is called as true rib.
True ribs.
Okay, what is the false ribs?
Last 8, 9.
8, 9, 10 is called as false ribs. And what is the floating rib? Back side. Okay, it is not attached with the sternum. So this type of classification is based on attachment with the sternum. Okay? So this surface is called as sternocostal surface. Okay? This region is called as costal region. It is attached with the sternum. So the first 7 rib is called as sternocostal surface. And this surface is called as contralateral surface. It is attached to the contral region. And it is attached with each and every rib. And it is not even attached, so it is called as floating ribs. Okay. So this is parallel to the number of thoracic cavity. Okay. So this is called as a simple part of the thoracic vertebral bone. Here you can see the spinous. This area is called as spinous. So it is located on the transverse side. It is called as transverse spinous. So here is a place where your thorax and the ribs region will be attaching on the back side. Okay. And a single bone of a rib have different parts. That is what we are going to see today. Okay. So we will be attaching like this only. Here you will have some areas for the cartilage. Okay. So this is the anterior part. So anterior part you will have an cartilageous part, and this is the anterior surface, and this is the posterior surface. Posterior surface have different parts. This area is called as head. Followed by the head, it is called as neck region, and this is the shaft region. Among this, the 7th bone is the largest bone in the ribs. Okay. So here, this shaft region have different forms of holes, which is called as foramen, where your blood supply will be going inside and coming out. Okay. This is called as groove or foramen. It is present on the costal surface, so it is called as costal groove. Okay. So when you keep here like this, it has 2 surface and 2 borders. This is the anterior surface and this is the posterior surface. This is the upper border and this is the lower border. So 2 surfaces and 2 borders will be present for each and every rib. And you will be dividing the ribs into typical rib and atypical rib. Typical in the sense it is looking like a same. That is called as typical rib. From the 3rd rib to the 7th rib, it is called as typical rib. Because there will not be a much change, only the length of the ribs only will be changed. Okay? So it has a head, neck and the shaft part and the anterior part. Okay? And first rib, second rib and 8 and 10 and 11, 12 are different rib shapes. According to that, it is called as atypical ribs. Okay? So what are the typical ribs? 3rd rib to 7th rib is called as typical rib. So I am having one form of typical rib here. So how it is attached with the vertebral column? We'll see once again. You can see that each ribs will be attached with the same form of thoracic vertebra. Okay? And it is also creating a gap. This is called as intercostal space. Intercostal space means a space between each rib is called as intercostal space. So the rib will be attaching with the corresponding thoracic vertebra. Okay? That means if it is a 7th rib, it is attaching with the 7th thoracic vertebra, but it has different forms of attachment. Okay? It is attached superiorly, inferiorly, and the tubercle part. This attachment is called as articulation. Any bone is attaching with another form of bone is called as articulation. So it is superiorly articulating, it is inferiorly articulating, and it has a tubercle, means a small opening. This is not an exact true bone, so we cannot able to find the tubercle. But if you see a real bone, you can see a bent-like structure or a mountain-like small structure, which is called as tubercle. So these 3 areas are attaching with the vertebra. The superior articulate, inferior articulate, and the tubercle part. 3 parts are attaching with the vertebral column. Okay, this is how it is attached. And this anterior part is attached with the costal surface. So what is cartilage? Cartilage is a connective tissue. Okay, cartilage is also one form of connective tissue. your sternum is attaching with the cartilage at the front. So now if you narrate a part, how many borders are there? How many surface and how many borders? 2 surface and 2 borders. What are the 2 surface? Anterior, posterior. What are the 2 borders? Upper and lower. What you call in medical term is upper and lower? Superior and inferior borders. So this area is called as convex region and this area is called as concave region. So the inner region is concave and the outer region is convex. Which is the largest rib here? 7th rib. 7th rib is the largest rib. So this part is attached with the cartilage and this part is have head, neck, tubercle and the shaft portion. This shaft portion, what is actually the function of the thoracic cage? What is the function of the thoracic cage? What is present inside a thoracic cavity? Heart. Very good. So it acts as a protective layer for heart. So it's not only the function, it's helpful for respiration. That means the ribs have a capacity to do an elasticity. That is what it is attached with the cartilage. Okay. So it elastically go up and down or forward and backward movement for respiratory support. So shall we do a respiration now? Deep inhalation, exhalation. You can see your rib movement here. So whenever your lungs is opening and closing, the ribs will also be supported in opening and closing. So other than protection, it also have a function of inspiration and expiration. Respiratory mechanism is also a function of ribs. Okay. Any doubts here?
No.
Okay. Thank you.